This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to this special episode of Rural Health Leadership Radio. Today's guest is Chad Cooper, President and CEO of Central Minnesota Diagnostic Imaging, also known as CMDI. So welcome to Rural Health Leadership Radio, Chad.
Thanks for having me.
So tell us about yourself. Who is Chad Cooper? What's your story?
Who is Chad Cooper? Geez, well, I guess I would start by saying, first and foremost, husband and father, been married to my wife, Beth, for going on 23 years, which is hard to believe as I say that. And
congratulations.
Yeah, thank you. And two kids, Matthew will be 16 here in a few days, and then my daughter, Grace, who just turned 14. So I guess I would lead with that. And, beyond that, I would say born and raised in the central part of Minnesota. Did my undergrad up at Concordia College in Moorhead. Concordia was, at least at that time, one of the few undergrad programs that offered a degree in healthcare administration. And then I've been very, very blessed and fortunate, honestly, to have started my career as a hospital CEO really at the ripe young age of, I think it was just shy of my 23rd birthday, if you can believe that.
Oh, wow.
So I had the privilege of leading a number of rural hospitals over the course of about 23 years prior to assuming this role here at CMDI a little over 2 years ago.
Wow, interesting story and interesting career path. So why did you choose a career in healthcare?
Yeah, it's not a real exciting story for me. I didn't have some predisposition. I didn't have a mom or dad who was a doctor or really anybody as a clinician or anything like that. I think for me, when I went up to Concordia to do my undergrad, I didn't really know what I wanted to do. I knew I was probably going to do a path in business of some sort. And then, frankly, growing up in a community of about 8,000 or 9,000 people that had, at least from my perspective, a quality hospital, there was a perception for me of, I think the work that was done within the four walls of a hospital being very noble work. And I think just a perception of almost, prestige being a part of a really important, community-based organization. And so I think ultimately the way I would answer that question is a career, at least in that time, going back 23 years ago, kind of traditional hospital administration seemed like a good meld of that desire for me to pursue some level of business path, but also get involved in healthcare.
Yeah, interesting. Yeah. So why the focus on rural health, though?
Well, I mean, that's, again, born and raised in a community of 8,000 or 9,000 people. It's what I know. It's really, I think a part of me. And what I would say also having, had the opportunity to lead a number of organizations over the last 23 years, I think rural is really unique, right? I mean, we get to go to work with our friends and neighbors and people that we know and interact with. We get to take care of patients that oftentimes are our friends and neighbors. And so I think there's just, when we think about rural healthcare, at least when I do, it's in some ways, it's a bit more intimate. I think there's sometimes a greater ability to feel like you've got more of an immediate and direct impact, both organizationally and in the broader community. And frankly, in a lot of these rural communities, as you know, I think that there's really a commitment and a need at a baseline level to ensure that we are providing basic healthcare services. But I also know that there's a lot of rural communities out there that have very progressive organizations that frankly have done a really good job over the years at lessening maybe some of that disparity between rural and non-rural, and really doing a great job, I'd say, at capitalizing on the opportunity to expand access and really ensuring that populations and communities are gaining access, frankly, to the same level of healthcare that they would in much larger communities. So it's a long-winded answer, but I think there's a lot of really unique aspects about rural. And again, it's kind of who I am. It's where I grew up, and it's what I've done for my 23 plus year career.
Sounds like it's part of your DNA.
It's perfect. Yeah, that's perfect.
So, Chad, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
Yeah, well, that's a great question. And I mean, we could take this conversation 100 different ways, right? I mean, I think for me, when I answer that question, I think it's important to understand that the lens that I put on is really that organizational leadership context. And so what I would say I mean, at a very basic level, when I think about leadership, I think it's working with stakeholders to define, create, and really communicate a plan and vision for the organization. And then I think it's also, beyond the plan, engaging people and resources to really execute on that plan. I had a former boss. I spent 7 years of my career working for Catholic Health Initiative, CHI. And when I started at CHI, my boss, by the name of a gentleman by the name of Dave Good, classy guy, solid leader. I remember having a conversation with Dave as part of my onboarding, and I said, Dave, what does success look like for me from your perspective? And he said, Chad, I work with a lot of great leaders who do a really good job. Most of them are really good at driving results and executing across some key pillars of the organization, but what's really, really hard is driving performance across all pillars of the organization. So for him, and I've held on to this over the years. I think when I think about successful leadership and effective leadership, it's really being able to engage, folks, leaders, people around us to really drive that performance across, all aspects of the organization. And I think the other way that I would answer that is, to me, that's kind of the what of leadership, but then I think there's kind of a how-to element. And for me, that how-to piece is really how we as leaders have the ability to impact really kind of the mood and culture of an organization. As you know, that's pretty important stuff, and it's very real stuff. And so I think over the years, one of the things that I've learned is there's not a prescriptive approach. There isn't a one size fits all. I think different situations certainly require certain leadership styles. I would say my preferred approach is really more of consensus building, engaging my team, people around me. And I think that works in a lot of situations. However, as you know, there certainly are situations where, maybe there's a sense of urgency, maybe you're dealing with a more inexperienced team. And that requires leaders, I think, to be willing to step up and sometimes just say, this isn't about consensus. This is what we need to do. I am the leader. I'm going to make the decision. And so I think that recognition is important. And I guess the last thing I would say, just as kind of a random thought, and I've gained a greater appreciation for this over the course of the years, and that is, I think one of the obligations and opportunities for me when I think about leadership is acknowledging that when I look at the team of individuals around me, everybody has a different level of opportunity, right? And so for me as a leader, part of leadership is really doing what I can do to get the best out of each one of them. And that really gets down, I think, to wanting to help and serve and grow and support those individuals. So.
Yeah, thank you for sharing your definition. I like the idea of kind of, you didn't call it situational leadership, but I think that's pretty much what you were describing, and
Yeah.
altering your leadership style to the situation at hand and the people, the context of the situation. So that's I appreciate that very much. So you're currently the president and CEO of CMDI, which stands for, again, for anybody who might not know, Central Minnesota Diagnostic Imaging, but you most commonly go by CMDI. Can you give us an overview of your organization and the community that you serve?
Yeah, well, I mean, CMDI is a great story, and trust me, I left an organization most recently where I was hospital CEO that I loved. Phenomenal organization, great culture, great facilities, great providers, great board. Really, really hard decision for me to make. I would tell you, I would not have made that transition if I didn't believe wholeheartedly in the work that we do through CMDI. And I had fortunately the opportunity to have worked with CMDI from the other side of the table, if you will, for a number of years. So, I mean, our story, and I'll talk fast because there's I'll try and give you the abbreviated version, but we were established in 1985 by 4 rural hospitals here in the central part of Minnesota, who really came together, and through I'd say a common level of dissatisfaction around a couple of mobile imaging providers, said, let's go out and do our own thing. So they bought a couple of vans, put a mobile mammography unit and a mobile ultrasound unit on that van, started providing service to those 4 hospitals. Quickly realized that they had been overcharged for years, and quickly realized that there was more and more request and demand for that service. So CMDI really started as a small mobile imaging provider, rapidly grew into, I would say, an expanded mobile offering, mobile CT, mobile MR. And then, probably over the last 15 years or so, has really evolved more so away from a mobile company. We still do a little bit of mobile. We've got a couple of mobile MR scanners that we serve some hospitals. We do some mobile nuke med ultrasound, but it's a much smaller portion of what we do than what we did historically. And so we've really evolved into a company through our mobile work that has been able to support a lot of rural hospitals transitioning from a mobile provider of imaging services to in-house fixed equipment, if you will. And so today, what happens is if a hospital decides they need a new CT scanner or expensive MRI scanner, really any type of imaging equipment is within our purview. Instead of them expending their capital, we will go out, we will buy the equipment, we will place it in the hospital, we will wrap full service around that piece of equipment, and then typically we'll charge the hospital on a fee per scan type of basis. Fundamentally, what differentiates us is our structure. So we are a not-for-profit 501e organization. So we are established under the hospital cooperative statutes. And what that means is if we put a piece of equipment in a hospital, Chad Cooper doesn't personally gain. We do what we do for all the right reasons. But as a cooperative, what fundamentally I think differentiates us from a lot of other traditional financing companies who would be more than happy to place a piece of equipment in a hospital, all of the profits and all of the excess of the co-op go back to our member owner hospitals. And that is huge. So today we are 67 members strong. We've distributed some $57.1 million in excess cash back to our member hospitals over the last 5 years alone. I think, people find real value and comfort in CMDI knowing that they've got a party and an entity and organization that's knowledgeable in the imaging world is able to go out. And I think, huge comfort when I think about service. There's a lot of our hospitals, I'll use CT, for example. CT scanners don't generally go down, 2 o'clock on a Tuesday afternoon during your typically, hours that service contracts cover. They always go down, on a weekend or evening. And so here's the deal. We know, and I know, that if a scanner goes down at 3 o'clock on a Saturday, a hospital can't take care of critically ill patients in the ED, right? So we're never going to ask a hospital to wait. No questions asked. We assume all of that risk. We get those vendors out there to get that hospital back up and running ASAP. And the hospital will never see a bill for that. It's all part of the risk. It's all built into our model. But again, at the end of the day, our cooperative statute, our nonprofit structure, I think really is a big part that differentiates us and our member owner hospitals. I think I've seen the value in that. Hence the reason we've been around for 35 years strong.
Yeah, it sounds like a great concept. I get it. Having worked in the diagnostic imaging business myself, I understand what you're doing, and yeah, you're bringing great value to your member hospital. So that's pretty cool. So we've all going through this major event in the world called the COVID-19 pandemic. What impact has it had on you and your organization?
Well, it's had a big impact because, as I alluded to a few minutes ago, our business model, if you will, is really derived on kind of that fee per scan basis. And so
haven't been a lot of scans, has there?
Yeah, right. No, it's been pretty much shut down. And so that's the answer to the question. As our hospitals go, CMDI goes, right? We really are an extension of our member hospitals and an extension of their imaging departments. And so it was tough, and it all happened pretty quick, as we know. So that's had a significant short-term impact on kind of our top-line revenue. Quite honestly, we could have taken a different approach with our member hospitals and invoked some of the contractual minimums and things like that. We didn't ever consider doing that. I think given our very integral relationship with our member hospitals, we said, we're all in this together. So we've really tried to extend some significant flexibility on those contractual terms to be cognizant both of CMDI needs, but also needs of our member hospitals. It's been painful. We saw about a 47 to 48% decrease in our revenues in April. It's not inconsistent with what a lot of our member hospitals have seen. The good news is, as we sit here today, things are starting to ramp back up. CMDI is a solid organization. It's been great that I think we could extend the flexibility that we were able to. But the other thing I would say just quickly is we employ about 80 individuals through CMDI. We're a small company, but for a number of our hospitals, not all of them, for a number of them, we actually provide staffing. We wrap
Oh,
staffing
wow.
around that equipment.
Okay.
So obviously our staff were pretty dramatically impacted as well, and we've done what we could do short term there. We were able to take advantage of some of the PPP dollars to provide some protection and staff there. So all in it together, day by day, we're getting through it, and life will go on. That is the good news. So.
Yes, as we get back to normal, whatever normal is in the future
Right,
here.
right. Isn't that the
Yeah.
truth?
So why is rural health important to your organization?
Well, again, it's who we are, right? I mean, if we look at our roots, we were started by four rural hospitals back in 1985, and so it's who we are. It's what we do. It's really the sweet spot. I think when you look at our model and you meld that with the need of rural hospitals and health systems out there. So it's worked well. It's a changing landscape, and I think that our business model will necessarily need to evolve as we look to the future. But there's still a lot of need, and frankly, I think this whole COVID pandemic, in terms of the financial impact that that's had for hospitals and health systems, in many ways, I think that's only going to increase the need for creative financing options, creative partnerships, if you will, around imaging and a whole host of other capital investments.
Yeah, that would seem so. So since you've run a rural hospital, you've got a pretty good perspective on this. When a hospital CEO or hospital leadership is trying to figure out who to use as an outside source for a product or service like you offer, what are the top three things that they really need to look at or consider?
Yeah, I mean, so if I just put myself back in that hospital
Yeah,
CEO role, I mean, I came, as I alluded to earlier, from a great organization. We had 240 days cash on hand, $35 million in the bank. We
nice.
certainly could have chosen to spend down our capital to buy our CT scanner in 2015, or a 1.3 million MRI unit, right? But I think part of it for me, and I'll just use myself as an example, philosophically, it's like, hey, in today's world, capital preservation is pretty darn important. And frankly, when you have a great option like a CMDI, where you are a member owner in that cooperative, um, my theory always was, why spend down our precious capital as opposed to preserving that for other strategic opportunities, strategic needs, the rainy day. And oh gosh, I never really knew what that rainy day would be, but this whole COVID pandemic, certainly has more than delivered on the reality of that risk being out there. So it's just a long-winded way of saying, I think the whole conversation around capital preservation, and certainly if organizations are in a position either out of need or choice to say, we're going to look for a third-party partner on our imaging equipment, CMDI is very unique insofar as we're a not-for-profit option. So there's plenty of for-profit options that are more than happy to borrow hospitals' money, right? And I'm not saying it's wrong, but somebody or someone is benefiting from that, right? I think our not-for-profit option that we bring forth, allowing our member hospitals to be owners in the co-op, where all of those excess margins and profits don't go to some third party, they go back to our member hospitals. That's huge, and that is a model that I don't think is readily replicated in very many places across the country. So, true partner. That's the third thing I would say. I mean, we are a true partner. When you look at my predecessor who founded CMDI back in 1985, he was a hospital CEO the same time that he founded CMDI, and ran both the hospital and CMDI for a number of years until CMDI just started to grow. And then Glenn, made the decision to leave and really grow and nurture CMDI full time. He did that up until his retirement 2 years ago. So we're founded in the hospital community. We exist solely for the benefit of our member hospitals, and I think those types of aspects really epitomize the notion of a true partnership.
Absolutely. One of the things that we like to do here on Rural Health Leadership Radio is share best practices. So what are some of the best practices that you've seen some top rural health leaders embrace around imaging services and equipment financing that you can share with us today?
Well, it's a little bit of a self-serving response. It's kind of an interesting question. I think I've not really thought about best practices in the context of our business model. But selfishly, I'm going to say looking to CMDI as a partner to me really is a best practice opportunity. It's an opportunity to avoid that that capital spend unnecessarily. Work with I say third party, though as I say that, I use that term loosely because of the inherent, membership component within the cooperative model. So, I mean, honestly, that's how I would answer the question. I think that the model that we bring forth to our member hospitals really is a best practice from, capital expenditure perspective, from a flexibility perspective, from a joint purchasing perspective. We spend probably $10+ million a year on capital investments for, our member hospitals, and that gives us sizable purchasing power, both on the front end capital side as well as service contracting. And every dollar that we can leverage, every dollar that we can save is a dollar back fully to our member hospitals. So again, it's a good story to tell, and I think our model is very consistent with a lot of the needs that these rural hospitals have.
Well, I know you've shared with us, what a great idea this is. It's even a best practice, right? So, can you tell us about one of your member hospitals that where your services have really benefited them?
Yeah, I mean, I'll give you, I guess, a couple of examples if I can, Bill. And I mean, one thing that I would say, and this holds true for many of our hospitals over the years, one of the unique opportunities that we have within our model is we have some hospitals that like to I would say turn over equipment more frequently. So maybe they'll run a scanner for 5, 6, 7 years, and then they'll want to refresh. We have other hospitals who are very comfortable running a certain piece of technology for 10, 11, 12 years type of thing. So, over the years, there are many, many situations where we've, for example, put in a brand new MRI in a hospital that's run that MRI for 6, 7 years. They've decided they now want to take that next step up in terms of technology or platform. And that scanner that's been in that hospital is still a phenomenal scanner that's got many years of useful life left. And so what we're able to do is actually move those scanners around, oftentimes to smaller hospitals that may not be able to afford a brand new $1.3 million MRI scanner. And everybody wins in that. So that's one example, I think, of flexibility where we're able to move technology around to allow organizations, and I'll use words that I've used from member hospital radiology managers, CEOs, where I've heard folks say many, many times, we've been able to achieve a level of diagnostic imaging capability through CMDI that we would have never been able to do on our own. There's other examples. We have a small hospital up in northern Minnesota that historically had a mobile MRI route. They were doing, I think, a day a week of coverage, about 21 or 22 scans a month. We were able to come in with a mobile scanner, not the newest and latest and greatest piece of technology, and we were all very clear on that, but absolutely the most affordable option for them to park a scanner on a trailer full time and really have full-time access to MRI services. And so we did that very, very cost-effective option for them. And literally within the first 3 or 4 months, they more than doubled their volume. And so that's really a segue for them to, on a very low risk proposition through CMDI, expand their access and really use that as an opportunity to say, hey, can we grow that business to the point where now we can, legitimately support a business case to put a full-time fixed in-house scanner, and so those, and there's many other examples, but those are just a couple of some of the things that we've been able to do for our member hospitals.
Excellent. Yeah, it sounds like you're really making an impact. Chad, you've got a good perspective. You run CMDI. You've been on a rural hospital CEO. When you think about rural healthcare in the future, what scares you the most?
Well, I think what scares me the most is really the whole affordability, issue when you talk about GDP and kind of that increasing trend line going in the wrong direction. The fact the United States spends more per capita on healthcare, all of those statistics, and so the reality is, I guess if you look at that and you go, that means something's got to give. That's what scares me. The something that's got to give, and something does have to change.
Right.
Um, the business side of healthcare, I think, is already started to get tougher and tougher in recent years, and is only get more tough. I remember going to a national conference probably about 7 or 8 years ago with my board chair, and the keynote speaker addressing a room full of 300 or 400 executives, board members, physicians. And he literally said, every single one of you in this room should go back to your respective hospitals. You should assume that your traditionally profitable commercial payer contracts rapidly move towards Medicare payment rates. You should understand how that will fundamentally change your organizations, and start making those changes and adjustments today. And looking back at that comment, I go, man, that's exactly what started to happen in recent years. So there's going to be more dollars flowing into the system, and it's going to be tougher and tougher, and that's scary. But collectively, back to your leadership question, there's opportunity somewhere in all that, and so
Sure.
we'll figure it out.
Right. Yeah. So, well, let me flip that question around. What excites you the most about the future of rural health?
Geez, I think, if I think back to conversations that we were starting to have in my position most recently prior to coming into this role, and frankly, if I go back even to the inception of my career, hospitals in many ways were very different organizations, 20, 25 years ago, right? And so I started a career, I think, really along the lines of more of a traditional hospital, path. But hospitals today, necessarily so, and I think rightly so, are evolving into different organizations than they were 20, 25 years ago. And that's the exciting part. I think, said differently, instead of thinking about how do we fill our hospital beds and how do we think about the traditional four walls of a hospital organization, that work's still going to be important. But I think thinking about the opportunity to have really at a ground zero type level, an opportunity to start impacting community, thinking about the work that we do in our role as hospitals, not just as the work that we do when people get sick, but thinking about how we can look at social determinants of health, and understanding those unique aspects at a community level, and really starting to think outside the four walls of the hospital. That's the type of stuff that excites me. It's also the type of stuff that I think requires, in some regards, a very different skill set than the traditional skill set, if you will, of a hospital CEO 20, 25 years ago. But it's exciting work. I think it's meaningful work, and hopefully, ideally, it gets to the core of really starting to have an impact on the things that really matter at a community level.
Absolutely. Chad, we've covered a lot of ground in the short time we've been talking here. If our listening audience only takes one thing away from the conversation today, what should that be?
I would say to consider CMDI as a partner, and we are here for all the right reasons to serve not only our current members, but really any hospitals, and I'll say more specifically rural hospitals across the country that have a need there. Well, we're kind of born in the central part of Minnesota here. We've got a very strong presence across Minnesota, some 50 plus members, up to about a dozen or so in Wisconsin, a couple in the Dakotas and Iowa. There really is nothing that prevents us from replicating what we do here anywhere else. So we're here, stand ready, and I am more than happy to make myself available to have a conversation with anyone anytime to better understand how we can help.
Chad Cooper, President and CEO of CMDI. Thank you so much for sharing your knowledge and expertise here with us today.
I appreciate it. Thanks, Bill.
If you'd like to connect with Chad, you can send him an email. We'll make sure your email address is in the notes along with this video. You can also reach out to his website, the company website at cmdi.org. And worst case scenario, reach out to me and I'll connect you with him. If you'd like to learn more about Rural Health Leadership Radio, you can check us out at our website, rhlradio.com. Or if you got a smartphone, who doesn't have a smartphone these days? Just use your podcast app and search for Rural Health Leadership Radio and subscribe. If you enjoyed this special episode of Rural Health Leadership Radio, or you know someone who might benefit from it, please share it. We're here to serve you. Until next time, let's keep working to improve rural America, one conversation at a time.